Hello, my name is Brenda Hinkie, and I'm going to be your nurse today.
Hi.
First, we're going to be assessing your thorax and lungs. Is that okay with you?
Yes.
Okay, perfect. Wash my hands. Okay, so I'm going to have you look up. Here we have the trachea, which is midline. We have the sternum and the mid-sternal line. Then we have the clavicles on each side with the mid-clavicular line. And then we have the suprasternal notch right here. Down is the angle of Lewis, and over is the second rib. And then I'm going to have you lift up your arm. Here we have the anterior axillary line, the mid-axillary line, and then in the back, the posterior. On the other side, we have the anterior axillary line, the mid-axillary line, and then the posterior axillary line. Okay? And then on the back, I'm going to have you turn around. On the back, we have the mid-vertebral line, and here are her two scapula with the mid-scapular lines. Okay, I'm going to have you turn back around. So here on her right lung field, we have the upper, the middle, and then the lower. On her left, we have the upper and the lower, and on the back, we have the two upper and then the two lower on the back. Okay, so next we are going to inspect and observe. So as we can see her just sitting, she's in the upright position, she's not over in tripod. Her ribs have a nice elliptical shape, she does not have barrel chest. She's not using any trapezius muscles, neck muscles to breathe. She's breathing just fine. No heavy breathing indicated. Her skin color looks good. Normal to ethnicity. It's good all throughout, pinkish tones. And the quality of her respirations, they are unlabored. As we can see, we're not seeing her breathe very heavy. So next I'm just going to do a test called the tactile firmitis test. So move my hands across and I'm going to have you say the word 99.
99, 99, 99, 99, 99, 99.
Okay, so that was heard throughout the anterior chest, and I'm going to have you turn around, and I'm going to do the exact same thing on the back. So, say 99.
99, 99, 99, 99, 99, 99.
And it is symmetric throughout. I heard the vibrations throughout all of her back. Okay, I'm going to have you turn around now. Okay, and on the front, I'm just going to percuss and see what sounds I hear. Okay, I'm going to have you turn around on your back. And over the front lung sounds, I heard resonant sounds, which is a normal sound. Okay, I'm going to have it turn back around, and there I heard resonant sounds as well. Above, we're probably going to hear more dull sounds, but over the lung fields, we're going to hear resonant sounds. So next, I'm going to auscultate. I have my stethoscope here with me, and I'm just going to clean it off. Cleaning. Okay. Okay. Now I'm going to be placing the stethoscope over your lung fields, and I'm just going to have you take a deep breath every time. And if you get dizzy or anything, just tell me. So I'm going to auscultate over her anterior chest. Take a deep breath. Okay, I'm going to have you turn back around. On the anterior chest, I heard no adventitious sounds, no wheezes, crackles, normal lung sounds. I'll have you take a deep breath. Okay, great. You can turn back around for me. And same thing on the posterior, over the lung sounds, I heard no adventitious sounds, no wheezes, crackles. So next, I'm going to be performing a series of 3 tests on you, the 99 test, the E test, and the whisper 1, 2, 3. So whenever I move over your different lung sounds, I'm going to have you say the words 99 for me again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and then on your back, go ahead and say 99 for me again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Since you're already on your back, and for that one, I heard no adventitious sounds. They were symmetrical on both sides. So since she's already on her back, I'm just going to have her do the E test as well. So whenever I place it at a stethoscope, I'm going to have you just say the words E. So
E, 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 E.
okay, so turn around for me. On the posterior chest, I heard all E throughout, no A sounds. The A sound would indicate an abnormal sound in the lungs. So again, I'm going to have you say the E.
E, 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 E.
Okay, and same thing on the anterior chest, I heard no A sounds, they were all E sounds, no adventitious sounds. Okay, so for the last test, I'm going to have you whisper 1, 2, 3 for me. Just a silent 1, 2, 3, 1, 2, 3, whenever I go over your lung sounds, okay?
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 2, 3.
Okay, and then lastly, I'm going to have her turn on her back. So in the front, no adventitious sounds. As we got lower, we could hear the sounds less, but up higher we could hear more of the whisper, but not so much clearly. Okay, go ahead.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
And thank you. Turn around for me. And same thing on the back. We heard decreasing in the whisper test going down the back, but still no adventitious sounds, no wheezes, crackles, anything like that. They were symmetrical on both sides. I could hear noises throughout, so all looks good. So that completes the thorax. We're assessing your cardiovascular system now. Is that okay with you?
Yes.
Okay, so to begin, I'm going to have you lay down. Okay, and I'm going to have you look to your left, and I'm just going to inspect your jugular veins. Okay, and then I'm going to have you look to your right for me, please. Okay. Her jugular veins are not beating out of her neck, they're not bulging, but elevation is properly there. So next, I'm going to be inspecting her pericardium area. So as we can see, there's no abnormal configurations, there's no leaks or thrills like that. Next, I'm going to be lifting up your shirt. Is that okay?
Yes.
Okay, let me get something to cover. So I'm just going to fold it up. Okay. And as we're looking for the apical impulse, none is visible at this angle. I'm going to go ahead and feel for it. It's not palpable, but if it was, it would be very light to touch. So, okay, next I'm going to palpate your carotid arteries. For this, you can actually sit up for me. Okay. Okay. And I'm going to palpate one at a time, not to occlude her breathing. Okay, let me feel your radial pulse. Okay. Let me go ahead and feel it again. And they're symmetrical with the pulses in her wrist. Okay, now I'm going to be auscultating your heart sounds. Don't know what that is. Okay, I'm going to go ahead and clean my stethoscope. Alrighty. Okay, so the first I'm going to auscultate over is here we have the aortic, then we have the pulmonic, then we have the second pulmonic, and then down. I'm just going to come up her shirt so I can hear it better. We have the tricuspid, and then over here we have the mitral. Okay, and I'm just going to be going ahead and taking a pulse from her mitral. Okay, is that okay if I come up again? Okay. Okay, so I took her aortic pulse for 30 seconds, and it was 33, so times 2 would be 66, which is in the normal range. The rate was normal. I didn't hear any murmurs, anything like that. Okay, so next I'm going to auscultate over your carotid. I'm going to look, I'm actually going to hear for any bruits over the carotid arteries. Okay, and no bruits are heard and no swishing sounds. That could indicate a carotid artery is occluded. So next we're going to identify the S1 and S2. So S1 is going to be normally louder around the apex of the heart, and then S2 is going to be normally louder around the base of the heart. So overall your heart sounds good, it's beating healthy, what we want to hear. So okay, so now we're going to be assessing your peripheral vascular system and lymphatic system. Is that okay with you?
Yes.
Okay, so on appearance we see that her skin color is good. Pinkish tones throughout, matches her ethnicity. I'm going to go ahead and I'm going to check for skin tumor. The chest. Okay, we can see that our patient is well hydrated. Excuse me. Next, I'm just going to feel for a temperature down the legs. She's cool to touch, not burning up or anything like that. As we can see, we don't see any edema present on any arms, on the legs, the knees, the feet, the ankles. No edema is present. So, next I'm going to be assessing capillary refill in the fingernails. So capillary refill in both hands is less than 2 seconds, which is good. Now, I'm just going to go down here and I'm going to do this on your toes. Cross your legs for me, thank you. Capillary refill on the toes is less than 2 seconds as well, which is good. And as we can see, no clubbing is present. Nail degree angles are not 180, which would represent clubbing, so that is a good sign. No clubbing. Okay. Actually, for this one, I'm going to have you lay down, and with me I have my measuring tape. So I'm actually going to have you maybe sit up, like, I just need your legs. So I'm just going to go ahead and feel the calves. Is there any tenderness, pain upon touching? Okay. So I'm going to go ahead and measure each calf. On her right calf, I got 38 centimeters. I'll go ahead and do the left. .38 centimeters as well. They're even and equal bilaterally. Okay, if you want to sit up again in the same position, I'm going to be checking her pulses now. Okay, so first I'm going to do your radial pulses. I can just do 2 at a time. Okay, next I'm going to be checking her ulnar pulses. Okay, and then next is going to be her brachial pulses. Strong pulse. Good. And since I'm already here, and pulses were felt throughout equally. Since I'm already here, I'm just going to be checking for her epitrochlear nodes. None are felt in the left arm, the right arm. None are felt. Okay, so the next thing I'm going to do, I'm going to do the Allen's test. So I'm going to occlude both of your arteries. And what I'm going to have you do is clench your fist. Whenever I say stop, leave it open. And then you will see blood return back in your hand. So go ahead and clench. Okay, and stop. There we go, okay. And pink tones are returning to the hand. So I'm going to do it on the other side. Do the same thing for me. Okay, stop. And as we can see, color is returning in the hands. Okay, so for this one, I'm going to have you lay down again. I'm going to be checking the pulses in her lower extremity.
Wait, lay down.
Actually, first you can just kind of sit up, scoot to the back. Because first I'm going to do her dorsus pedialis pulses. And they're both equal bilaterally, strong pulses. Okay, I'm going to do your tibial, posterior tibial. And those two are equal bilaterally as well. Okay, so for this one, I can have you lay on your back. I'm going to feel for your popliteal pulses, which is behind your knee. I meant on your stomach. I'm so sorry. I am having you move all around. Okay. And pulses are felt bilaterally in this position. Okay. That may be comfortable, but I need you to sit up now. And as we see, whenever she returns, color is normal. Still no edema or swelling going on in the legs. So everything looks good.